So you've got muscles either side of here as well. What are they called, Nid? Obturator?
Obturatus internus
There
and
we go.
externus and glomerulus, I think it is.
Good, Ninj.
The deep ones in there.
Hey guys, Tash here from MMT. Got Ninja on the table. And we're going to work on Ninja's lower glute area today, / hammy. We're going to get into a ligament.
Yep.
That's a bit overlooked, what we've experienced in our years treating clients. If you work through this hamstring area or glute area, it can, just be a bit, a bit of an undiscovered kind of ligament and fascial area that we're going to check out.
Yep.
So firstly, we'll show you on the mat what it looks like on the skeletal chart here. So we're going to get into this this whiter area here that's coming from the sacrum and then coming into the ischium here. So it's called the Sacrotuberous ligament, okay? Let's have a look on Ninj. So I'm going to, so a lot of the time we work on our hamstrings, our hamstring attachments right at that ischium, the lower ischium there. So this time we're going to find that area, that bony, and then we're going to sink, instead of holding on that bone and hitting those hamstring tendons, which we commonly do here in the clinic, and work on the hamstring area, we're going to actually, we're starting on that bone still, as we always do, getting connected there. Can you feel that, Ninj?
Yep, that's really good.
Good.
Feel the bony.
Yeah. So
point.
Start at that bony
landmark.
Thank you, Ninja. Save the day. And then we're going to just slowly glide up. And then we're going to start to hit a bit of that fascial and ligament area there. All right, so connecting the sacrum to the ischium. So it's in the lower glute area. It can, be overlooked. So what we were talking about before is that Ninja was saying as well that a lot of people come in and they've had other therapists try to work on them and they just can't find the spot. You know, they've treated their hamstrings because it's really close to hammy. It's easy to think that it would be the hamstring muscles and tendons, but if you're still feeling that ache, that pain through this glute or in their lower back, it can be coming from this area. So I'm just going to sink up a little bit higher again, Ninj.
Yep.
Are you right there?
Yeah, go for it.
Good. Still feels like we're on the money?
Yep. Yeah, you can probably go in just a fraction deeper.
Yeah.
And that'll kind of, I'll feel that ligament we're talking about.
Yeah.
And the deep rotators, deep glute rotator underneath the big ones on the outside.
Yeah, and that's the thing about the glutes, hey, you've got to really sink in deep. There's so many layers there, right?
Yep.
Yeah, so I'm using my thumb here because there are like the size of the ligament as well. I'd rather have a bit of a broader, and I can definitely palpate better through my thumb as well. So it helps me to guide me on where I'm going and what I'm feeling. Still doing all right, Ninj?
Yep, really good.
Okay, cool. I might actually I want to go back. I'm just going to sink out slowly and just go to that spot where I was before because I feel like that coming in at just this different angle. Tell me what you think though, Ninj. Hopefully using the thumb you guys can see a bit clearer where we're working. Slowly sinking, but can you feel that, Ninj?
Yeah, starting to feel it now.
Yeah, I think this angle's a bit better.
Yeah.
And I can use my body weight through my arm to get some leverage there.
Yeah.
Good.
I think you released it off a bit before we started filming.
Yeah.
Just having a practice,
Yeah, that's right.
Yeah.
Yeah, so that definitely feels better. So you've got muscles either side of here as well. What are they called, Nid? Obturator?
Obturatus internus
There
and
we go.
externus and
Yeah.
glomerulus, I think it is.
Good, Nid.
The deep ones in there.
Yeah, so classically, I think a lot of people who are sedentary might have some issues going on in here. If there's not much activation going on in someone's glutes, we really want to use your glutes, fire them. If you're not, then these areas are probably going to start to get stuck and painful and restrictive. What kind of other areas, Ninj, do you reckon? Do you think even people like maybe even like cyclists and like being on your bottom all the time?
Yep.
They could have some.
Yeah, definitely. People that are driving, like drivers, yeah, they can definitely have problems down here. You know, sort of sitting, but also using the pedals. You know, machine operators and truck drivers and bus drivers and things.
That's right.
Yeah. But it also can be lower back pain. I think you were kind of talking about that a little bit before. So yeah, sometimes your back pain might be coming from a different source, and you might be just treating the lower back a lot, but then it's not really resolving because I suppose other things are compensating and pulling on it. So it might be somewhere else on the pelvis. That's so it could be groins, it could be hip flexors, you know, it could be psoas or something.
Yeah, because you've got to think about where it's attaching to, being the sacrum up here. Like, that's so involved in the pelvis, the hips, how they're positioning, there's tilting going on, it's all going to get affected. So just reminds you of how connected the body is, and how, you know, even if your pain's up here, something can be coming from somewhere down there. Yeah, so that's what we do here. We've got to think outside the box, don't you, Ninj?
Yeah, correct.
Yeah.
It's our job, isn't it, to be the investigator and work out the puzzle.
Yeah.
And I suppose, clear things as we go. I think that's one of our best things. When we find things, we deal with it. And we don't just wait for it to come back next week or something. It's, we found something that's important. We're going to fix it, melt it down. And
That's it. So I'm just doing a bit of reinforced thumb to help out as the thumb fatigues a little bit.
Strong.
Good. Yeah, so just trying to keep that sustained pressure so that we can get as an effective treatment as possible for Ninj. All right? Because the last thing you want is a pain in the ass, hey, Ninj?
Correct.
Yeah.
We've got to get rid of that pain in the ass.
Yeah. There you go. Yeah, so I've just kind of moved. You can see that mark lower down where we started, and then we're just traveling up. Kind of lean on top a bit, change my angles a bit there. Get more weight over the top of the thumbs. Go a little bit out there. Doing all right?
Yeah, no, it's really good.
Cool.
I'm just thinking that people just aren't getting this work done.
Oh,
it's overlooked. It's all unknown.
Yeah.
But it's can be essential for person's recovery, and we use this part of our body a lot. You know, when we're kind of climbing stairs and different things. So sprinting and lifting, squatting. So
you need to use this. If you're not using it, then you're going to have issues anyway. Probably different issues, but. You need to activate your glutes. So important. So important.
Yeah.
All right. Sink out there for your Ninj.
Yeah. Sweet.
So guys, if you want to come in, get this ligament worked on and work out what is going on. If your pain just hasn't been resolved, your pain in the ass, and you want to work on it, or you want to find someone that's going to investigate and make sure you're fixed. You know, we won't just look at those typical areas only. We're going to investigate all those obscure ones that Ninja loves, and get the job done for you. Yeah. Yeah.
That's it. Thank you.
Thank you, guys. Thanks for watching. See you soon.
Done.